All right, in the interest of time, we're going to go ahead and get started. Thank you all again for joining us for the Dunn Chamber Business Impact Mental Health in the Workplace Roundtable. We really appreciate everyone and their time, and we really hope that our attendees get a lot of great information from this roundtable on this topic. But I'm going to turn it over to Bryant Pope. He's our VP of Economic Development, and he is the chair of this committee.
Hey guys, thank you all for being here. I'd like to call the meeting to order. I'm going to start by doing a quick invocation, and then we'll kind of get into some housekeeping items, things like that. If you would bow your head with me. Dear Lord, we pray for guidance. We pray for listening ears this morning as we talk about a topic that really has so much impact for both the businesses in the area, the employers, as well as the employees. We pray for help through such an odd time, and a time that really has answers unanswered, questions unanswered. So with that, we want to pray for the chamber. We pray for all these businesses that will be listening, as well as those in attendance today. We pray for the presenters and the information, and hope that it's helpful and guide to those listening and those being affected by this terrible disease and virus. So with that, we want to say amen. Again, want to thank you all for being here for this Business Impact Roundtable. We've titled it Mental Health in the Workplace. We hope that all of you find this information informative, just like we were talking about, as we navigate this mental health and how it directly affects you, your employees, and your businesses. A couple quick housekeeping items. We want to make sure you keep your microphone muted at all times during the presentation, unless you're looking to speak. Also, the event is being recorded and will be shared via the Chamber YouTube channel afterwards. So if you want to rewatch it, want to share it, you can do that. We will also take some questions after the presentations have been made. So please jot down any questions that you have and save those questions for the end. At the end, we're going to have that Q&A session. We'll open that up to a formal session. So, or enter in the chat during the conversation, and we can monitor those and ask those questions at the end as well. At this time, I want to welcome each presenter, and thank you again, guys, for your time. Want to kind of start with, I've just got them in random order here, but when I introduce you, if you could tell us who you are, what your organization does, and where you're at, and then also how we can take advantage, or how someone can take advantage of your services. So I've got presenter number one here listed. I've got Christy Hawley. If you could unmute.
Hey, good morning, everyone. So my name is Christy Hawley, and I'm the Director of Behavioral Health at CommWell Health. And we are located, it's a Dunn address, but we're out in Sampson County. And we're actually located, we have offices all throughout the eastern part of North Carolina. And we provide behavioral health services, which includes mental health and substance use services. We also provide medical services and dental services. And you can go to our website at commwellhealth.org and just learn more about our services. Like I said, we have multiple locations in the area.
All right, thank you, Christy. And again, thank you for being here.
You're welcome.
Secondly, I'd like to call on Amy Brown.
Hi, I'm Amy Brown. I'm a licensed clinical social worker and the director of Daymark Recovery Services in Harnett County. We're located just outside of Buies Creek on Highway 421, technically a Lillington address, but it's right outside of Buies Creek. And we also provide mental health and substance abuse services for anyone between the age of 3 and 103. We have therapy services. We have 7 clinicians here. We have nursing services. We have psychiatric services. We have both an adult and a child psychiatrist on staff. We're very fortunate to have that. And we have walk-in and crisis services Monday through Friday, 8 a.m. to 5 p.m.
All right, awesome. Thank you, Amy. Third, I've got Rebecca Holtdorf. I hope I said that right. Holtdorf.
Hey. Holtdorf, yep, that's exactly right. It's a hard name. I'm Rebecca Holtdorf. I am the Human Resources Head of Harnett Health Systems. We have 2 hospitals, one in Lillington, one in Dunn, and then we also have 7 primary care providers. So we're always looking to expand, but we pretty much provide health care for the Harnett County area. We are certainly right now working on COVID vaccines and other things going on, so we're very busy, but I've been in human resources for almost 10 years now, and just try to make sure that I'm providing the best I can to my employees, and so they can help everyone in the community at Harnett County.
Awesome. Well, thank you. We appreciate you being here, Rebecca. And lastly on our list here, I've got Deborah Ferguson. If you could just unmute. Sorry.
There we go. Just took me a while. Hey, I am Deborah or Debbie Ferguson. I own Tapestry Counseling that's located in Bliss Day Spa in Dunn. I have another counselor, fortunate to have another counselor that's working with me here, Amy Beasley. I'm an outpatient facility, and we see Amy said from 3 to 103, and I see ages 6 to 96. So here in the at Tapestry. So, and thank you so much for inviting me to be aboard.
Well, thank you so much again for being here, and we're excited to hear from all of you. One person we did have on the list today, but unfortunately we're not able to join us, was Marcia Gibson. She's a program specialist for the behavioral health of NC Department of Health and Human Resources and Division of Vocational Rehabilitation Services. Unfortunately, she was unable to attend, but we are excited to have all 4 of you panelists today, and we'll just kind of jump into some of the topics that we have. And what I'll do is kind of as a format is I'll have a topic. I'll read off that topic, kind of, open the floor. And then as you guys want to dive in, we'd love to hear from each of you in each topic. So the first program topic that we want to address is called Trends in Mental Health and Wellness for Employers. So I'll just kind of open that up and see, you guys dive in and give us your input on that. And from a structure standpoint, if you want me to, I can call on each one of you and then kind of go from there. We'll kind of start with you, Christy, if we can go there.
All right. So as we all know, with the pandemic, with COVID, this has had, such a huge impact on not just the way that we work, but the way that we live, the way we work, the way we play, and pretty much every aspect of our life. And, it really has had a huge impact on just mental health in general. And so I was, as I was preparing, just kind of looking up some information, I ran across just some interesting data in regards to prescriptions for medication. So one that was really interesting to me was that the week of March 15th, which is when some of the stay-at-home orders were in place, that 78% of all antidepressant, anti-anxiety medications, and anti-insomnia medication prescriptions filled were all new prescription versus being refills. So that there, was just really stood out to me that, as a society, we are, this is very stressful for us at home, at work. Some of the activities that we have been accustomed to do to help manage stressors and to make sure that we have those supports have definitely been changed. They're not available to us. And people are just, really struggling with coping. I also found some other, I think, interesting data which is about women. You know, women have really been impacted. I mean, everyone has, but women have also been impacted, you know, with COVID and just managing like the work-life balance. And 70% of health workforce is made up of women, which I just found, you know, really interesting. So when you consider nursing staff, community health workers, social workers, healthcare facility staff, whether it's, you know, someone, you know, cleaning, you know, just different areas of healthcare. And so those workers, as all of our healthcare workers, are, you know, under a lot of stress, you know, really facing a lot of challenges. And, you know, one of those is just burnout.
Yeah. Thank you so much, Christy. Amy, could you dive into that topic as well? And if you need me to read the topic again, I can do that, but it's just trends in mental health and wellness for employers.
Well, as far as trends, I think that given the COVID situation, it's very interesting that I see many employers focusing, rather than the knee jerk, I have a sick person that needs to be seen, employers tend to be more focused on maintaining health as it is before it needs treatment, which I find to be very much needed, and it should have been in place a long time ago. It's so much easier to identify problems when they're not as significant, not as developed into a full-blown mental health crisis so much. So I think the wellness and the management of stress has really come to the forefront for employers, at least. And we're finding, you know, as a treatment facility, we treat the bigger problems, but we're finding that issues with fitness, with insurance companies being more proactive about health and wellness as opposed to treating illnesses, has gotten to be a big deal. And it makes sense because it saves money, it saves employees, it saves emotional pain, physical pain, and you know, the ability also of employers to be more flexible as far as allowing employees to work from home, allowing them to flex their time sometimes when it comes to children being at home, and just to have that ability. And you know, we're all a work in progress, and to find out that, hey, there's more than one way to do this. We can work around this and we can adjust and adapt. If nothing else, we have proven that we're a very adaptable society with COVID-19 changing everything. And the ability of employers to do that has been really good for the most part.
Thank you, Amy, so much. Lots of great points in all of this. Next, Rebecca, do you mind sharing on this topic?
Yeah, absolutely. So certainly trends when it comes to mental health and wellness for employers has been something that is almost kind of like the Cadillac of an employer, is someone who has wellness programs or some of the other, you know, mental health programs. It's not been something that has been common. And as Amy had mentioned, we should have been focused on how we can kind of maintain that wellness pre-pandemic long before it became a focus. But certainly what is trending is having these established wellness programs that not only have incentives tied to them to try and really reward employees that are actively trying to improve their wellness or at least maintain what it was pre-COVID, but is also trying to, in these kinds of times, have telehealth options or well-being apps. So those are really trending. And thankfully, because of the virus, one of the things that has been positive from it is the telehealth options are much more affordable than what they might have been before for employers, and they're starting to really see improvements and kind of see their money coming back to them because employees are able to have that access 24/7 and remote when they're working from home or having to stay at home orders or other things that might be going on because of the virus. The well-being apps are still a little expensive, but there are some that you can get from counties or state officials or things like that, that they're working very hard from a government perspective to get out to employers. So I do encourage, if you have the time and resources, to dig into some of those free well-being apps. They do help employers to really incentivize. Some of the things that I know we've done is we tried to incentivize with giving away a TV and a Fire Stick and some of those electronics for folks if they got their annual physical from one of our providers. So if they took the time to go and get their physical and do some of the other pieces of the wellness. We also did a wellness challenge, so to speak. So we had folks who, instead of just focusing on the weight, it was more on your body ratio and kind of what you had as far as wellness, and send out little tips like after Halloween, what you can do with your Halloween candy so you don't just sit around and eat it, or, you know, what you can do around the holidays. So things like that are really trending that they can get remote and do from home. So employers are really looking for better options to be able to afford it. And thankfully, there are some good telehealth options out there and a few well-being. Hopefully those apps will pick up in the next couple months or year.
Thank you so much, Rebecca. And last but not least, Debbie, can you please talk about this topic for us?
Sorry, having trouble with my mute button. So along those lines, one of the things I'm noticing with the insurance companies too, they are like offering no copay for telehealth sessions, and there are telehealth sessions available for those who need it. As far as trends that I'm seeing as a counselor, of course, there's the anxiety and the fear that everybody is dealing with. And of course, that's brought. So when I was looking at the different topics, that fear, that anxiety is brought into the workplace. The other thing that Amy had posted, she was talking about the teens, that they're really struggling right now, that she said, I'm seeing a huge influx of kids in my office due to depression and anxiety. It's specifically due to COVID. Clinically speaking, they are mostly struggling with low levels of serotonin. You can help them by getting them out of their bedrooms, off the Netflix, off of social media. They need to be exercising, need to be active. They need sunlight. It's especially important right now since the days are shorter and many are doing virtual remote learning. So, and that pertains to us too. You know, we all need to make sure that we're getting enough sunshine. And as employers, we need to make sure that we are providing positives for our staff. And because there's a lot, Lord knows there's a lot of negative that's surrounding us. So just like you were saying, Rebecca, the incentives, those, you know, that would be good for employer incentives, you know. But yes, as a trend, the trends I'm seeing is a lot of fear, a lot of anxiety. So, you know, employers making available time for their staff to get the care that they need.
Awesome. Thank you guys so much. I know this is a hard, broad question to be asking, and obviously in every section of this, there's a little bit difference in what you're seeing, how you're seeing, and I'm so excited and glad that you all from different walks of this are being able to give your input to this, because I think it's very helpful. In what you're seeing and what we're seeing, obviously as people, but also as employers, as businesses. So definitely appreciate your comments on that. The next topic is going to be strategies to prevent employee burnout and improve employees' work life. So we'll kind of start with Amy, if we can go with you first.
Okay. Well, there's some very common sense things, and I'm always a common sense approach person. We've learned to be creative, but having a routine is very important. Most routines have kind of flown out the window, especially when you're having to deal with home situations being upended, sometimes having kids at home, kids who are struggling with the virtual learning issue. Kids are just as stressed as we are, and they show it in different ways. So dealing with that can be very stressful. But some just common sense approaches that may help to relieve some of the stressors is get up 10 minutes early. It's amazing what you can do and how you can get yourself organized in that, giving yourself that extra 10 minutes and not having to rush at the last minute. Take care of yourself. Nutrition, your basic health care issues. Make sure you take your medication if you are on medications. Recognize that you don't have to do this all by yourself. A lot of times, women especially, we're terrible at it, about not necessarily the martyr complex, but I can handle this, I can do this. And you don't have to, and you shouldn't, because it leads to resentment and frustration, to say nothing of exhaustion. Ask for help. Be a team. We're both in the workplace and at home. Work together as a team and share responsibilities. The flexibility, as we've talked about, if you need some flexibility in your schedule, talk to your boss. Your boss can't read your mind if they don't know what the problem is. That doesn't mean you have to lay out all of your home issues, but to say, look, I'm struggling. I've got an employee, we're 8 to 5. I've got an employee that has to get her kids to school now. And she says, is there any way that I can come in at 8:30? I hate to ask. I'm like, sure you can. Take half an hour for lunch, and you can come in at 8:30 if that works for you. And it was like this huge load was taken off of her shoulders. And I'm like, you've been worrying about this for a really long time, haven't you? And she had, and didn't tell me. But so to be open and honest about that is really important with your employer, so y'all can work together. Also, one thing, if you have the luxury of doing this, leave work at work. You can't always leave home at home, because you have kids that are calling you, or the teacher's emailing you, or whatever. But if you can finish your job at the end of the day, close the door, turn off your computer, and go home, and don't think about it until the next day, that is a huge step towards your own mental wellness and not being so overwhelmed.
Thank you so much, Amy. Lots of good things there. Definitely going to try to maybe even get up 10 minutes early myself. So thank you for that. Next, I'll go with Rebecca. Can you weigh in?
Absolutely. Yes. Strategies to prevent burnout. I mean, this is something that is so crucial right now. And as some folks have mentioned, certainly the flexible and remote working, if you have the ability. For us at Harnett Health System, that has not been an option for most of our employees. So we've had to get very creative. Our patients are still here. It's 24/7. So we've really had to look at not only supporting the employee at work with the EAP program and other traditional things, but also looking at their entire well-being. This pandemic has hit so many different areas of someone's life. You know, it could hit them financially, it could hit them in their career, it could hit them emotionally. There's so many different areas and ways that we can help. So we've tried to do things like offering them a local credit union and having the credit union come out and give them information to try and help them financially. Giving them, instead of having, you know, the dogs that usually come and go to the patients, and they can't do that right now because of COVID patients. So we actually had them come in for employees to be able to sit with the dogs to try and calm them and give them a little bit of a break. So sometimes it's just thinking of creative things that maybe we used to use for patients or for other folks during crisis time, and taking advantage of them for our employees. We've had to do that. And part of that is educating them. A lot of times folks don't even realize that they're burnout. You know, they're there to help. They've always done this. Women especially, we can do it. So part of it is just educating that these could be signs of burnout. If you're having trouble sleeping, these are resources we can give you. Or if you're having trouble, you know, waking up and getting going for the day, if you're snapping at people, we've had to sit down and have a lot of talks, you know, hey, what's going on? Help us out, you know, and let us know how we can help you, because sometimes people don't even realize they're burnout. And then once you educate them on what burnout can look like, because it looks like different things for everybody, you really have to focus on the tools. An employee assistance program is been around forever, and those are very useful. except for some people really aren't going to take them. So sometimes you have to bring it to them. We have a EAP counselor who will come on site every once in a while. Like I said, we have the financial counselors come on site. So sometimes you have to bring the help to them, but you really have to focus on trying to personalize it for each employee, which at this time we have 1,000 employees. It's sometimes difficult. We found, though, if you just sit and talk to them, I'm not a normal HR person who sits in our office. I'm actually very rarely in my office. I round and talk to the employees and say, hey, what can we bring to you? And if I can't bring it, then I at least say, okay, I couldn't get this for you. Is there another option? So really making sure that you're getting in touch with your employees and seeing what they need. Sometimes they're very scared to come forward. As Amy mentioned, she had been carrying that weight, that employee, for so long and just needed to ask. So sometimes when you sit down with them and spark that conversation, you can see what you can do to personalize that help for them.
Thank you so much, Rebecca. Yeah, it's different for everybody. So just understanding who and what you've got is a big deal. So, Debbie, do you mind stepping in now?
And that's what I had somebody I worked for, and she taught me something valuable, that she scheduled self-care in on her calendar. You know, she set aside time for herself, and that was things like go for a walk, or she made sure that we did not ever have lunch at our desk, that we, walked away from our desk and had lunch. But certainly, focus on, evaluate self, what you need, what your needs are, recognize the fact that you're being irritable and that you do need a break and you do need change, and take those breaks. And of course, main thing that is important is that you do talk to someone, that you share how you're feeling, and that somebody can validate those feelings, and turn off TV, turn off the social media, to reduce the anxiety.
Point. Sometimes that's hard to do, but I think it is important to kind of zone or get into your own zone and be yourself. And I like the scheduling self-care. That's neat. So, Christy, can you weigh in on this too?
Yes, and you all had some really great ways that we can take care of ourselves, as well as for our employers. Just to kind of piggyback off of everyone else. So something else is with leadership, with our employers, it's really important for leadership to normalize mental health issues as well as stress, because really this is something that we're all going through. And to normalize that and let people know that it's okay to seek help, it's okay to talk about it, and really just work on just reducing like the whole stigma of mental health issues as well as seeking help. And that's something that can start at the top and just trickle down. Just also educating employees about burnout and stress, providing them with resources, whether it's through the EAP. Here at CommWell, we have weekly, they're called Eagle Tweets, and it's just an email that goes out to all of our staff. And in that, we get lots of information, but there's always a section that talks about something mental health, whether it's a local resource, it's an article, it's, how to contact your EAP, but just, resources for our employees to use during this time so that they can, really work on managing any stressors. Also, just providing training for supervisors, for managers, to let them know, signs to look for, someone who is typically on top of things, and, their behavior is starting to change, where maybe they're missing assignments, they're coming in late, maybe the way that they're dressing has even changed, that, those could be signs of depression, and just really creating an environment and a culture to where we understand our employees, understand each other. We really foster just acceptance and diversity, and just being open to talking about things. I actually read an article a couple of weeks ago, and it talked a little bit about the benefits of the commute, which most people are like, I hate driving to work, and all of that. A lot more people working from home, the commute is no longer there. And so in this particular article, it talked about, the commute was really a time to transition from my role as I'm at work to my role as I'm going home, to be a parent, a spouse, whatever. It was a time to reflect and to just kind of soak in, the day and prepare for what's coming next. And so it was suggested to have some type of transitional activity in between, when work is over, between, being an employee to now I'm being a parent, to take a walk, to meditate, to do some type of physical activity where you can, mentally just transition to your other role, even though you're still at home working. And like the other everyone else said, flexibility is just huge right now. Employers are just really being flexible and understanding their employees.
Your point about the commute makes me think of that commercial where the man's getting the coffee in the kitchen and he's like, gotta leave for work now, honey. And she's like, what do you mean? You work down the hall. And he puts his headphones on and he actually walks outside the house and comes back in. I'm ready to work now. I think those are spectacular topics. And I think those are the types of transitional points that we used to take. Like you said, you get in the car, you listen to a podcast, or, you listen to your favorite DJ in the morning or whatever. I do think that a lot of people who are working remotely right now are not taking those transitions. I know when I worked from home, I was guilty of that. It would be like at 9 o'clock, stop talking to me. And that doesn't work because my son is 7 and he doesn't understand that. And so definitely I would recommend those transitions are very important right now.
Thank you all for your input on that. And thank you, Heather, for your comments too. So I think we can all normalize this and feel like this is, it somehow has impacted us, and we'd be crazy not to think so. So next kind of topic, in the essence of time, just moving into those, would be strategies to create resilience for a mentally stronger workforce. And we'll kind of kick that off with Rebecca, if you can dive in first.
Yeah, so resiliency is so important right now for anybody. We're having to be resilient. We're having to move with the change, with everything with the virus. And really, we've talked about the understanding our employees, and part of it really is engaging our leadership. We have tried very hard with this, and I'm thankful for the leaders that we have, because this has been a big part of it, is how we can make sure, as Christy mentioned, the normalizing some of the mental health and making sure that there's not that stigma is really getting the leadership down in there. So we created a Facebook group that's private just for our employees, and we've been posting and really encouraging our leadership to be active on there and showing that they're in the trenches working. So like today we have our president, our chief medical officer, our chief nursing officer. They're cleaning benches and tables for people to be able to sit down and get the vaccine. And they're posting pictures on the Facebook group so that employees can see that it is a stressful time, but we're being resilient together. Our leaders are working with you, and we're moving with the change, and we're not leaving that separation or kind of leaving the employees high and dry. So that's important. So we've done a lot of that and making sure that our leaders have been upfront with it. We're also providing resiliency training. So we're doing that for our leadership and having someone come in and talk about some of the mechanisms for resiliency, how you can really make sure that your team is working and being resilient when the changes are coming so quickly. So that's really, really important. And then again, just asking for that feedback. We can't change or know what we can do unless we hear it. So we'll post things and we'll say your feedback is confidential. Let us know what's going on. We'll try and make sure that everyone knows they have an open door. I've put a couch in my office, not to sit and relax on. I'm too busy for that, but to try and make it a little more welcoming and not have that stigma of being, oh my goodness, the scary HR building and I'm going to get in trouble if I go in there, but more of a place that they can sit, share feedback, and we can help get through this together. So that's been a big, resiliency is just huge right now because it's so important.
Thank you so much. Debbie, can you dive in on this too?
Sure. I think some of these topics, it's like it's me, myself, and I, and Amy that's working in this place. But I do understand, just like Rebecca was saying, the importance, and what I stress in a lot of my sessions is the open communication. You know, just staying on top of things, listening to people, hearing what the employers need, what the employees need, and just being receptive to that. I think that's the main thing that's going to be helpful in all of this, is just validating each other's feelings and listening and hearing one another.
It can be really hard to do sometimes. So I think that's very important to try to focus on each other when you're working with employees and employers, and then just, you know, opening up where people can talk to each other. I think right now is just really just that communication.
And providing incentives like she was talking about for the employees. I know somebody was telling me that a school system provided an Aren't You Glad It's Friday, and had a bunch of orange colored snacks for all the teachers that they could go and have during their break time. And it was just something to add positives. And, you know, we just need, like I said before, positives.
Thank you so much. Christy, do you mind?
Yeah, so, and as Rebecca and Deborah were saying, you know, just the communication piece, and also, you know, just stopping to reflect, you know, with employees to say, hey, like what's working, what's not working, and really create just an environment to where your employees feel comfortable being honest and sharing, you know, their true thoughts, you know, they're being honest in their feedback as far as what's working and what's not working. So I've been a counselor for 10, 12 years. It's been a while. So I know what it's like to be a counselor. And in my leadership role, I don't know what it's like to be a counselor during a pandemic, providing only telehealth. So, you know, I've really just leaned into the behavioral health staff to say, you know, what are some problems that you're running into? What's working? What's not working? What can we do to make it better? Because I have no, you know, I had no experience doing that, and really just relied on feedback from them, and, you know, follow through with their suggestions, because something that I may think work really just, you know, doesn't really work. And so, you know, following through with any feedback that you get, and also, you know, making sure that employees have the tools that they need to, you know, complete their job, to do their job remotely, and just, you know, making sure that they feel safe.
Thank you, Christy. It seems like we all got a job to do, but we're all trying to figure out how do we do it in a different area, place. How do we do it differently? What resources and those tools you were talking about may be different than they were, you know, a year ago. And so those tools are important to make sure that we're talking to them. But I definitely like talking about reflecting what's working, what's not working, and figuring out what to do moving forward together. So thank you. And let's see, I think last one on here, Amy, sorry about that. I was going in order here. Amy, you've already unmuted, so good job. Thank you.
Okay. I think it's really important, again, you know, the communication is so important, but recognizing sometimes we don't communicate clearly. Sometimes we say one thing and we are expecting others to read our thoughts or know what we're thinking. And that's not the case. So communicate clearly. Tell your employer, tell your employee what you need. And don't beat around the bush. It's important for us to be on the same page, and I can't be on the same page if you're saying something that I don't clearly understand. So think about that. Also, allow yourself to feel. You don't have to be the Superman or the Superwoman. You can allow yourself to vent, to laugh, to cry, to tell jokes. Never underestimate the value of humor, especially in difficult times. Sometimes the humor's not always the most appropriate, so be careful where you use it and how you use it. But laughter is truly very, very good medicine. And again, don't try to handle situations on your own to prove something to somebody, to prove something to yourself, how strong you are, how you can do this. You don't have to have the shoulders of Atlas. Enlist help. Your partner, your parents, your kids, your extended family, your church family, your friends, your coworkers. People really value and appreciate being needed and helping each other.
Thank you so much for that last comment on that topic. So what we'll do is we'll move on to the next topic here. And it's going to be resources for employees on mental health, as well as COVID-19. So we'll kind of kick this one off. Debbie, if you don't mind.
So as far as employers needing resources for when their employees need counseling or need that type of care, then a great resource is psychologytoday.com. And you can go in under psychologytoday.com and they can find a counselor that they can speak with. And that's a very good resource as far as when they're seeking, if they were seeking counseling or seeking personal care.
All right, awesome. Christy, can you tell us what you've got?
Yes. So Psychology Today, definitely a great one. And they have some really good articles too. There's also the National Alliance on Mental Health, so NAMI.org. Just some great resources. And if you do a search for workplace and mental health, something will pop up. SAMHSA is another one. I know that, we're talking about a lot of mental health issues, but I think, we should also incorporate substance use because there has been definitely an increase in individuals, really struggling with substance use, addiction, and, has gone up especially, to cope with COVID. And so SAMHSA has just tons and tons of resources that's available. They actually have a handout on there. It's about 14 pages and it's my absolute favorite. It provides mental health resources and substance use resources. It provides support groups online that are free for a wide range of mental health, substance use disorders. For employers, so I found on the CDC, so cdc.gov website, there's a section called Worksite Health, and they have this other section called Worksite Health 101 Training, and it comes with this manual. And it had it covered topics about alcohol and substance misuse, depression, stress, and then there was a section on just various other health conditions that can be for employers to incorporate in the work setting. But there's also resources for employees as well.
All right, Amy, your turn.
Okay. As far as local resources, most employers do have an EAP program. That's more for short-term mental health issues, which can be extremely beneficial. If people find that they have more extensive needs and they need longer-term care, they can certainly utilize Daymark or any of the providers in the community. Sandhills, our LME for Harnett County, they cover, it's an 8-county region, but you can call them and they can locate a provider for you. That telephone number is the one that I don't have in front of me. Let me see if I can remember it. 1-800-246-2452. I think that's correct. 1-800-2, I think it's 256-2452. As far as mental health crises, Daymark is available 8 to 5 Monday through Friday. Of course, most people don't tend to have mental health crises any more than their kids tend to get a fever during those hours, as always in the middle of the night or on the weekend. Mobile Crisis Therapeutic Alternatives is an agency that provides mobile crisis, and it is crucial in helping folks who are truly having a mental health or a substance use emergency. It is a free service. It is 24/7, and their telephone number is 877-626-1772. And they can actually come to you. They can be at your home within 2 hours if you give them permission to be there. They don't have a doctor, they don't have a bottle of pills to give you, but they certainly have trained clinicians who can be extremely helpful in getting you where you need to be, helping to deal with the crisis of the moment. And they're really helpful as far as keeping people safe and getting them the help that they need.
Who is that again, Amy?
Therapeutic Alternatives Mobile Crisis is 877-626-1772. And that is a 24/7 service.
Thank you.
They're always available. Very, very helpful.
Awesome.
And we'll get some of this information as well, some of these links, and send them out to everybody. And we'll make them available as well through the chamber email update. We'll do some, you guys have given me some great ideas. I think there's a lot of, like Debbie was saying, mom and pop operations that maybe they're not, financially able to offer EAPs, or maybe they haven't even thought about offering any sort of programming. So you've given me some wonderful ideas on how the chamber can be a great resource to our employers and to our members for some of these wonderful resources, and certainly working with, our member organizations and keeping folks aware of what is available locally, because I don't think everyone realizes some of the services that we have locally in this respect. So I've been writing as fast as I possibly can for myself, but we'll put together some resources and share those with everyone as well, because I know there's a lot more information out there. And I have looked at some of these things that you guys have mentioned, and I think they're great starts for sure. So thank you for mentioning them. And this is definitely, as you've all said, a topic that seems to be a little bit stigmatized, not a little bit, a lot stigmatized. And I hope that people realize that these are trying times. These are not what we are built for. Actually, I was saying the exact same thing to my husband the other night. We're not built for this type of lifestyle. We're not built for these closed off, stay in your bucket, in your bubble lifestyles. We're social creatures. And I know I struggle with that. I like to be out and about. I like to be person to person and talk to folks. And so I can tell you there are times when I'm just like, I get overwhelmed, and it's good to know that there are definitely ways to working around those feelings and working through them instead of giving in and succumbing to some of the tougher times, and looking forward to some of that prosperity. So thank you all for those resources. Those are great.
Thank you. Thank you.
I did want to add too, and I forgot this part, but a lot of, as you said, a lot of employers do not have insurance. So there are many, many uninsured folks out there, folks who don't have dependent children and can't get Medicaid if they're, the working class, that working folks that just can't get insurance. But we have a sliding scale based on family income and the number of family members that they have. So, and we can work with people. We don't refuse anybody if they're in crisis. So that's a pretty good resource. And again, Sandhills can also help find other resources that work under the same context.
I'm glad you brought that up, Amy. And so we're the same way at CommWell Health, and we're a federally qualified health center. And so we have a sliding scale to where we do provide all of our services based on income, for those individuals who are uninsured. and we serve Harnett County, Sampson County, Johnston County. So anyone, locally in those areas, we do provide those services based on income.
Thank you all so much. Rebecca, I want to give you a chance to speak on the topic as well.
Yeah, so you guys mentioned all kinds of options, so I won't reiterate them, but one thing we found helpful and have done for our employees is we added a mental health psychology piece to the telehealth. So employers can do that, and it's actually a little bit more affordable than what some of the psychological, services might be. So it was something we were able to provide for our employees 24/7. They can call that number and they can get a psychologist who can help talk them through. So that is an option that employers can keep in mind as another way to provide for their employees in addition to EAP. So we basically have 3 options that our employees can call 24/7 to get mental health as a part of our benefits. So that's one way. We also got creative. We have to try and think of all different ages. So, some folks are not as comfortable like traditional kind of ways, but we do offer apps as well. We try to give folks apps, whether it be meditation apps. People forget that there's apps that can really be a good resource if you just need breathing exercises. It can talk you through breathing exercises, and they are free. So if it's somebody that we know is an employee can use those resources, you can just easily go to an app store and you can search breathing exercises, meditation. And what we do is we also have those listed in our wellness rooms. So we have 2 mental health rooms, and I did provide pictures of those, but they have a massage chair in them so that it can focus on kind of massaging the body and trying calming them in that way. But we also have sound therapy in there. We have light therapy. We also have the sand therapy. So we try to offer as many therapeutic options within that room that they can go in and have access to. And we have them at both locations, our hospital locations. So one of the things that we found that was really difficult was for our nighttime staff. So I know some folks might not have that problem, but we had a lot of nighttime staff, and having them walk outside wasn't necessarily safe to have them, roaming the streets at night, or some of the other things weren't as safe. So this was a good option where they can go into that room, take that break, use maybe a free app, or call one of our 24/7 resources that's listed on a sheet in there, and they can get the help that they needed. It's been extremely difficult with some of our COVID patients, and some of the nights get really long. And so that's a great way for them to say, okay, I need to step away, get themselves together and take that break and be able to get back to it.
Thank you guys so much. I'm excited to learn more about what that sand therapy is like, Rebecca. That's interesting. So thank you all for covering and providing all these tons of resources. Like Heather was saying, we'll try to combine this information and get it out to where it's usable for those watching and for those going to rewatch, hopefully. So one of the last topics that we have here, and I know a lot of this stuff has kind of overlapped a little bit, but we really want to talk about what community strategies there are to help employers in improving mental health for their employees. So to kind of start this last topic off, Christy, if you don't mind, throw it your way.
Okay. So just, I really, think that the community, the way our community really has just, shown support, offering COVID testing sites, I think offering, local vaccines, so putting up the healthcare hero signs, just, really showing support for all of our healthcare workers who are, on the front line. Our frontline workers, essential workers, has just been one, it shows appreciation and has just been a morale builder to, help those healthcare workers and other essential workers know, that we are in this together and we do appreciate them. So I think it's, just really important for our communities just to show support to each other.
Amy, if you could weigh in.
I think one of the big issues that we're having right now in our community is childcare and what we can do with the children who either their daycares have closed or they're with the school situation being almost a day-to-day, something changes all the time. To have, I can't think of anything that would be more stressful for a parent than to work day to day and not figure out what am I going to do with my kid after school if they can go to school, or what am I going to do as far as getting my child caught up on math that I have no clue how to do. So I think to utilize community resources, if there could be some sort of a networking something with churches, communities, civic groups, to have volunteer tutors, to have church members to help pitch in with babysitting. And I realize all that is all that can be kind of tenuous too with the COVID issues, but I cannot imagine anything that's more stressful than not knowing what I'm going to do with my child this week or next week. Or maybe I can piecemeal this week, but I don't know what I'm going to do 2 weeks from now. So to have something like that would be just so important. And again, utilizing all the resources that you have. If it's a next door neighbor that is a homeschooler or whatever, think outside the box. I think that's really, really important. And perhaps, you as the chamber could perhaps open up some sort of a resource network for something like that.
Thank you, Amy. I appreciate the challenge you put forth. So that's why we do this, is to trying to talk about what we all can do as a group to be helpful. So thank you for that. Rebecca, if you don't mind, just stepping in.
Yeah, so that was one of the things I was going to mention, Amy, that would be great is, it's difficult to find those resources for the community to have for help, for someone to help babysit or someone to help with remote learning. Sometimes it's really difficult right now to do, even if you're working from home and you're given flexibility. It's hard to be helping with school and trying to get your work done. So having those resources or someone that can help is great for the community. A lot of folks kind of forget how it feels, or kind of the feelings that people get when they feel like they're helping. So I think it would be great too if there was community sharing opportunities for folks to go and volunteer and kind of give, because that's really big for the morale when employees give back. We've had a couple employees who have done some giving back opportunities for the community and going and volunteering, and it seems to really mentally help them feel like there's kind of a normal, like they're doing something in a very hectic, crazy time. So that would be great if there was a resource or an opportunity. I know we have to worry about COVID, but if there's things that we can do safely, I think that would be helpful. And then certainly morale boosting activities. I know we can't have crowds now, but even if it's just setting up Zoom meetings like this where people can just chat and again have that connection with the community that folks are missing. One of the things we notice when people have come for vaccines is that when they'll sit there, these are people that haven't been out and they haven't seen their neighbors and they've been kind of quarantined, and these folks are so happy just to see them. They're yelling from one table to the next, how's your grandkid doing? How's your husband doing? So I think if there's that way, and technology is hard for older folks, but if there's a way for the community to do it where we can kind of build those connections better during this difficult time, I think that would be a great resource. So I challenge you guys to that. I haven't been able to figure out a way yet, but if you do, let us know.
Thank you. Sorry about that. We were switching over.
Technical difficulty.
Yeah, right. Nancy, you provided some information here. I'm just going to try to drop that in the middle of this conversation. It says NC Care 360. It's a statewide or coordinated care network that connects individuals with the community resources, including childcare options. So I'll read that off again. It's NC Care 360. So again, thank you so much for that information, Nancy.
And yeah, and thank you all. And certainly there are a lot of aspects of how this has affected different people. And I think you've all made great points too. We need to know how we can continue to help. And I think Rebecca and Amy both, thank you for putting that out there, because it is something that has been a topic that I've been thinking about for a long time. Is we see all these opportunities to help, but there isn't a good network on how to communicate those to the other entities. So that is something that I really want to try to work on. And, you know, Bryant and I belong to First Presbyterian Church, and Howard Dudley is our reverend, and he's part of Duma. And I think that really, if we could reconvene something and bring some of those groups together, I think we could put something great, and definitely something that I want to keep in mind. And we'll try to see what we can make come of that, because I think last year, 2020 was difficult, and it was a year that no one expected. No one knew exactly how to navigate. And so I think after seeing how some of those things kind of came about and the mechanics behind them, I think maybe this year we'll be better poised to put some of those programs to the better good. And I will definitely be working on that and keep you all in the loop on how we can maybe work together on make those more available for our businesses and our employees. I think it's very important because like for instance, the food bank, the people that you're seeing at the food bank now might not be the people that you expect to see there. And if we're not keeping that thought in mind, that this is affecting different groups of people now, and they might not be learning the information because they might not be in the network for the usual users of those types of services. So definitely thank you for that. I'm going to keep working on that, and I will keep you all posted on what we come up with. And hopefully we'll get a plan or a program that will utilize, everyone will be able to utilize. So thank you for that. I appreciate that.
All right, and last but not least on this topic, Debbie, do you mind your information now?
As you said, Bryant, there's sort of an overlap of resources, community resources. I would be amiss if I didn't, and maybe I'm going backwards, but talk about the spa here where I work as a good resource for somebody for self-care. We have massages available, facials available. We have a sauna. So it's really good to, during a stressful time, to take care of themselves. And the other thing too is that we are very appreciative, I know I am, of the chamber and everything that they're trying to do, such as this, to add to and help our community. So that's a great community resource too.
Thank you all. I guess that closes our formal session of program topics that we had. What we will be getting into now is we're going to be opening up our Q&A session. I don't know, do we have any questions that were in the chat?
Well, no, before that, was there anything that any of our presenters would like to add that maybe didn't fall in some of the topics that we discussed, or if there was anything in addition that you thought of in the process of this conversation that you would like to share? We have some extra time, so we don't want to shortchange anyone. If you have additional information that you'd like to share with us, otherwise we will then move on to question and answers if any of our participants have any additional questions for us. I'll open it up to anyone who might have something extra.
Well, I do. Rebecca helped me to remember this one as far as a community need, and that is maybe something to help others who are not very tech savvy. To help them, figure out Zoom, the DACC, so that they can, remain safe and still attend their medical appointments, their therapy appointments, and different things like that. Because here at CommWell, for behavioral health services, we're providing all of those services via tele or by phone only. And so there's certainly a need for that, just for people who, may not have never downloaded an app before, just to kind of help them, educate them on that so that they can, not only take care of themselves medically, mentally, but they can utilize some of those apps and technology to communicate with family and friends, and to really stay connected.
That's a great point, Christy. I do think it's we take it for granted in this technology age that everyone knows that your smartphone is essentially a computer. And I had this conversation with my mother-in-law the other day. She said, I don't know how to find that information. I said, you have your phone in your hand, right? She said, yes. I said, open Google. She went, why don't I think of that when I want to know something? And so I know we're talking about getting away from the technology, but unfortunately, technology is probably going to be more prevalent in everything that we do for the near future. So absolutely, maybe we could look at some ways in offering some community support kind of topics on how do you use Zoom if you're on a telephone or on a smartphone, and how do you access this information, if you have limited resources. So I will look into that as well and see if maybe that might not be something that we can put into this community sharing network and offer some of those opportunities to help either our aged or less inclined community members that maybe don't have access to the internet but need resources. We can maybe help spread some of the information on how they can access that. So thank you. I like that.
Yeah, I think it's important to understand that technology is there. It can be very helpful, but it can be also very detrimental if it's not managed well. And so I think you guys were talking about like limiting screen time and all that kind of stuff. But also if you have it and you don't know how to use it, it can be frustrating. So knowing effective ways to do that can allow you to gain more information, feel more confident in what you're doing. And you may want to join more of these sessions or things like that, and you don't know how to do that. So thank y'all so much for that feedback. Is there anybody else that has anything else they want to add? Well, I know we've covered a lot of information today. What we want to kind of do is just close out our formal session now, and we'll move into some Q&A portion as well. I believe, Heather, you may have a question or so that we want to answer. So I'll turn it over to Heather on that.
Yes. So while we've been talking about a lot of the information on how things have affected us, I was curious, Rebecca, from an HR standpoint, are there some useful tools for some of our small, I know this doesn't really apply to Harnett Health, but in the HR aspect, some ways that maybe some of our smaller employers that don't have HR departments can maybe implement some of these tools and strategies in their business for themselves? Because when you're an owner operator, you can't schedule an hour break to go walk around the block, or if you're not at the cash register or at the desk, you can't run your business. Any things that you can help with our smaller business owners that might be hearing this or watching this later and saying, well, that doesn't apply to me because I don't have 1,000 employees. Any small tips that you would like to add to that for them?
Yeah, so it is hard. When you are a smaller business, it's really hard. The wellness rooms, that's not going to be feasible. So you are right. Some of the things that I always try and say is, again, if you have that tech savvy person, even if they have to be at the cash register or if they have to be at a station, if they have their phone next to them, being able to put some soft music on that maybe wouldn't be detrimental to the business, or if they need to take a minute where they can take a breath or do some meditation, anything that they can use those apps for. Now, if they're not tech savvy, that does create a little bit more of an issue. As a manager, I think that you can be flexible without necessarily saying work from home. So I know sometimes if, maybe the work is done and somebody just needs to sit and chat, sometimes just being out there with them and saying, hey, how's your family doing? Hey, how's things at home? Just listening to them and giving them that opportunity to chit chat, to kind of have a little bit of flexibility so it's not 100% all 12 hours or constantly focused on work. One thing that we've had to do and that I really encourage, we've talked a lot about screen time. We were having a lot of issues when we had the TVs on in the lobbies, because we're focusing on COVID, but what's happening on TV and news with, riots and politically, it was creating a lot of turmoil and stress for folks, even for patients. So we've actually turned our TVs off. So I would encourage folks, if you're in a small business where maybe you have a TV or something in the corner that has some of that extra noise, it can really intensify the stress at work. If you're at work in a stressful situation and you're seeing the stress that's happening on, around you in the world. So little things like that can really help as well. So just trying to make sure that you are there for them in all kinds of ways. Being creative with your flexibility. There's some days I show up with breakfast for employees. On our Facebook group today, we said, share something nice that you're doing for someone today, or a kind word that you shared with someone. So trying to share positivity. Thank you notes go a huge way. So even if you're not there with your employees every day, giving them like a thank you note that's sitting on their desk or at the register when they come in, so they just know that they're appreciated, is a huge thing. So those are just little tricks that make them feel like they're a part of something bigger and that they have support, even if you're not right there able to give them a break for an hour.
Those are some great points. And I have a smartwatch, and one of the widgets on my smartwatch is not only my heart rate monitor, but it's called a stress meter. And every once in a while, it'll start beeping because it's watching, or it's paying attention to my heart rate, and it'll say, it's time to breathe. And then you click it and you breathe in for 5 seconds, you breathe out for 5 seconds. So absolutely, from time to time makes me think about it. As well, I have a little movement monitor on here, and it says, you haven't moved for 90 minutes, it's time to get up. So, a lot of times we ignore those. Like right now it's saying it's time to move, time to stand up. I think a lot of the times we're like so focused on what we're doing that we forget that those are just as important moments as, before. In our office, it's like, well, I could just buzz Felicia and tell her what I want to say. No, I'm going to get up and I'm going to walk out from my office to her office and speak to her, because that's just another opportunity for me to step away from the chaos of my desk, and take that small break from focusing on the task that I'm working on at the moment, because it may not always be the most pleasant of things to have to try to accomplish. So I think you're right. All of you have said wonderful things. And I do think that the one thing that I'm probably the most guilty of personally is self-care. I don't take enough time for myself. So that's definitely at the top of my make important for 2021 is self-care for myself. So thank you for pressing that subject, because I really do think it's very, very important.
Yeah, I would say as employers or employees, we're probably all noticing how this COVID, the vaccine, the virus, everything has really played more of a work-life balance than really anything else that we've kind of all dealt with. I think you're seeing more of the outside influences coming into the workplace and affecting how people are performing at work, because it's displaced people, or it has caused some sense of unnormalcy that everybody kind of is just trying to figure out how to work around. So, I'm curious, and I'll open up to anybody on this, but what are the biggest differences that you're seeing between, men and women? Is there a big difference between how people are reacting to this, how they're discussing their own mental health and reaching out for resources? Is there a big difference?
I think that there is. I think that even today, women tend to be the primary providers of everything at home. There's no such thing as 50-50. It's gotten better, but I still think that women are the major jugglers in our society, having to get the kids to school, get them fed, get the house clean, get the dog taken care of. It's just a tremendous challenge. And I think it's very important for women to say, I need you to help me. And that can be sometimes hard. Sometimes our ego gets in the way of that too, because we're so used to managing and juggling that it seems very abnormal to not do that. But I think it's so important. And what somebody said earlier about the value of being useful, it's so important. And it's a habit that we all need, COVID or not, it's a habit that we all need to have. But I think that men financially tend to be more concerned about the job, about earning money and, going to work and making sure that there's not a problem there. And I think they do feel pulled when, oh, you mean I have to pick up the kids from daycare this afternoon? How am I going to get off from work? I can't do that. But again, talk to your employer. And I think that sometimes they're a lot more flexible than you think that they are, because you've never asked before.
Thank you so much, Amy.
I think, honestly, I think the biggest thing, and I hope some of those folks that are on this call that have leadership roles have really taken some of these ideas and will be implementing them, because I think it'd be really important to keep in mind, rather, that even though the vaccine's available and more people will be getting vaccinated every day, the vaccine's not the answer to COVID. It's not going to get rid of it. It's not going to make you impervious to it. It's just going to lessen your chances of suffering greater from it. Let's hope. At least that's the purpose of it, right? I think we need to also be addressing the fact that, and this is a topic and a saying that gets thrown around inside the chamber a lot, a new normal way of life is not normal to how we're used to operating. So I do think that once we start implementing programming that kind of takes away the bad word of the new normal, I think more people will definitely utilize services like the ones that you all offer, and not feel like it's a shortcoming. Because I know in the past, men don't talk about their feelings, and they don't go to the doctor unless they're dying, and they don't, and women are always like, run to the doctor. And so I think maybe in this case, we all need to be running to the doctor a little bit more often, whether it's the psychologist, the counselor, the whatever, the gym, if that's who you want to call your doctor. I think those are very important things that you have all said, and definitely I hope everyone has taken some of that and will be utilizing it within their business.
Yep. And with that, I'd like to open up the floor, just make sure that anyone else on the call, if you have a question, that you can go ahead and ask that. And if not, we'll move to adjourn the call.
We have a couple questions
Okay.
here. Let's see here. Janet Davis from Vocational Rehab Services wants to let everyone know, remember that when you work with individuals and they need assistance for employment, to contact their office. They're there to work with those folks with disabilities, to help them find gainful employment as well. Their phone number's in the chat. Otherwise, we'll also include that in our resources page when we send that information out. And then previously, Aaron Driver, also with Vocational Rehab, wanted to remind everyone that they do community services for individuals, mental health and other diagnosis, SUD diagnoses, and they can provide individual placement and support services for employees and employers, and peer support services. So honestly, oh, that's JCI. I apologize, Aaron. JCI Industries offers a lot of those services for our community as well. So we do have a lot of resources out there. I think it's just the impetus is going to be on us is to make sure that they're being communicated and that we can find a community output that would help those who need them, search them out and use them. So thank you again.
All right, with that, I'd like to wrap up and just say thank you all so much for joining us today. Thank you to the participants and the presenters, as well as those just joining the call and RSVP and getting on ahead of time to listen. I know that everybody has heard, and we hope that take back and practice what we preach, right? So, and then also too, like, I just know there's helpful tips and things like that we pulled away from this. We will try to get all that out and in an informative way for everybody to use as a resource. So thank you all again so much. And I hope that everybody has a great rest of their afternoon.
Thank you all, and stay safe and stay healthy.